Iqaluit. It is Friday, November 27th. As usual, Premier will start us off. Today, Minister of Economic Development and Transportation has an announcement. Dr. Patterson will speak, then we'll go into questions, and at 11:45 we're going to end the questions, and Minister of Health will speak and wrap it up. Thanks.
November 27th. Segulat na kalimalaw ni Minister Akaya kalimalaw ayang malo Minister Kusugak kalimalaw miyo apersuat sitak.
Nunavut mi ublaku tiapaki ublumi hitaman ni ami hungoreartu tako nunavut naryo akaktu Nunavut iluani tamang mi akveni lutitako nutango yu hitaman. Maano Nunavut katidukta akluget 151 nuvan naryo akaktu. Amata kwa maliktaw himayut nuvan na yakangi mga tatay mga pigarapta 4,744 nguyut. Amata kwa 765 huli maliktaw yut kawya haktaw yut nuvan na yakangi mga ta. Kawya mayung atana adjungit yako ayong naktuk yako ta awda tarapta tana hanat tayliw law minuat ya. Tana nuvan na yo Nunavut iluani las nitana adjungit ya tamani la kawya mamala sutatako Inuit pakalang mata kihani kuwe hupunga tako man na okaktu dorama government ku tuni hina matakina yang mi hamlet kun nunaling nun $1 million mi tuni hina ta hamlet lukta nun tana nakimu atop taw na tuni amatay ko nunali nuvan na yo akaktu kangagut tana 1 million iluani tu la kangagut tuniyo kanang na matakina yang mi takwa nunali nuvan na yo akaktu kina yang mi angin na kami tuniyo ne kihani nunali lukta kina mi tuniyo ne nakita ko tibun takwa kano angitigi mi kina mi pina mga ta ten na ito kay kwa nunali 1,000 atani inuli 20,000 taon niya kay kwa nunali 1,000 atani inuli 4,500 taon tamaya 45,000 taon niya Iqaluit 100,000 taon niya amata na kinaw ya tuaver lutat tuninyak tabuta hamlet kunut atoktaw ga kandaring matkaw magama amma okay nakta matamani Nunavut government ga ikayong narap ta Nunavut miumi amma ikayuin na naksuta amma hunamiyayong na doakpat ikayong naktu tamani tugut ikayong narap ta Nunavut miutani amma Nunavut miutaluk tamat nawak pagka nalat siatang mata amma tukihilmat siatu tako ayong naktu ko suta adjiungit yakut man na outlarap ta inuhi bu adjiungim malaksuni Nunavut miunalat siak mata kawi magama ako suti pitta mata makawi mamaksunga inu kati naglihut taksutit ikayok taksutit takwa mai yung matia anya afta na kating galuk talut atau cikut ana nuban na yo halage ne aptigo matna chem ap paki matna na mitai matwa yung na Nunavut miu ne matna uhi. Good morning. Today Nunavut has 4 new cases of COVID-19, all in Nunavut. All in Iqaluit. Nunavut now has a total of 151 active cases of COVID-19. The total number of persons followed to date is 4,744. There are currently 765 persons still currently being followed. I know there has been some uncertainty over the last few weeks as we have had to deal with the reality of the virus in our territory. I am pleased to announce that the government of Nunavut will be providing $1 million towards community food programming in contribution agreements directly to the hamlets. This way, communities will be able to adapt food programming and delivery to meet their specific needs. The amount will be determined by community size. Communities under 1,000 people will receive $20,000. Communities over 1,000 people will receive $45,000, and Iqaluit will receive $100,000. And there will also be extra funding for communities affected by COVID-19 to help offset any urgent needs. As always, we are here to help, and we are working to find ways to ensure you're getting the support you need during these trying times. Thank you to all Nunavut Mute for your continued patience, kindness, positivity, and hard work over the last few weeks. I'm proud and thankful for everything you've done in our fight against COVID-19. Let's stay strong, let's stay together. Stay well, stay safe, and stay home. Thank you, Nunavut Mute.
Uluko pasi Nunavut katika Nunavut tulimat uluko pasi amalu kamatia pasi tana Nunavut tuara temani tilugu bila tiara suin napugun tana Nunavut 19 tamangara man upengasa mutilugu tako api verle ikut ini kayu ikut lo piga sikau tigilak sama mata tamak kuninga namin nakatuni ikayu tau yare hakatatuni kina yani sana wartini polati ni kamaji hakatatun ni vid amalu tako naminili atok tau sama kau tigilak sama mata mana yok tako 440,000 ni ikayu tok sama lapugut tako ninga ikayu 106 ni naminili ni Nunavut min tamak kuninga kilami yun ikayu tigiyaw gayak tuni tako nga naminili no udlumiyo mana kuwes punga tana ay pakilaw niyo tana pigel tikan na atigon teko pilok tilo amalo pinasukkan na kumayi Nunavut naminili kotilin mana temana kinawini tusirakan na kung nangyararibot 500,000 kidli kalago takot government ngudlo tamani piliritia sukata takoninga nunalini kanayani sakyakti tiwin piliriti to marimata amalo pivaleuti niyo yun Nunavut min takot naminili aksumariaro pimarayo gigatigo mana tako tatatorialini kinawini tusirautini pinasukun naksibusi makoni paipani tatatorialini sakyaktukat laksuni kano piyam ng naksautin na suksutigut tasuminga tana nuvarnadwagaro tamani tilu temen tilu tana pivat leyo lagi kunni kayo lagi kunnilo tako akisimalagivon atawasumi paipamit tatatataw yung naktimin kaso mga ikayo tayo yung naktiyaktuni tako naminilino kano kinaway tusiraw tigigayak ta sinyawasi tana pekoti sinon ubaron ni aurad jusi sinuk akingin nun temen na itilugo tako kawigayakan na kung naktasi kakasawyak or ikalawik kun www.gov.nu.ca/SBSP la sumidlon. Terminated lugutan na nuvarnadwagaro tamang nunadwamo kan tilugo nunavumela tilugo ikayo kan nivut sakya kan naman koyan nami pivakaktitaw tasum. Good morning, fellow Nunavut Mute, and thank you very much for giving me the opportunity for this. As you know, when COVID-19 first became reality in this early spring, the Department of Economic Development and Transportation responded with a small business support program funding to assist artists, tourism operators, retailers, and other small Nunavut businesses that were adversely affected. This initiative has so far provided close to $440,000 to 106 Nunavut businesses to help meet the short-term needs of our small business community. Today, I am pleased to announce a second round of this initiative. Once they have completed reporting on their first contribution, the small Nunavut businesses can now access another contribution of up to $5,000. As governments, we are committed to supporting our local economy and employment, and Nunavut small businesses are an important part of our economy. To apply for this funding, applicants just need to complete and submit a short 2-page application form to provide the basic explanation of how your business has been affected by the pandemic. My department has also developed a 1-page fillable form to assist applicants in calculating their business-related working capital and other operating costs. This information and all regional contracts details are available on our website at www.gov.nu.ca/SBSP. As you see the immediate impact of the second wave of COVID-19, and right here in this territory, our government is committed and will remain committed to helping our local businesses adapt and survive. Someday soon, I know they will once again thrive. Thank you for giving me that opportunity.
Good morning. Yesterday, the Minister of Health extended the public health emergency to December 10th. Extending the public health emergency every 2 weeks provides us with the authority to take additional measures, such as issuing public health orders to respond to situations like the ongoing pandemic. Renewing the public health emergency every 2 weeks does not mean that current restrictions will remain in effect until December 10th, but it does allow us to issue and adjust orders to respond to the circumstances by easing or tightening restrictions as described in Nunavut's path.
Ulla sakut ipatsana hanang itulerin ng minister nga unga variar sila nga na hanang itulerin ng mo tuwa vernak tikuro te harnitin ni December 10 mon. Tana unga variar tao nga na hanang itulerin ng mo tuwa vernak tikuro tao nga makupi na swaro si nato ay matik. Pivira ko tao vamat ane hanang ituleri marimo sangi ni harun nakulugo kakan nga na malit tao kay gunarlo ni sulot ane hanang ituleri ng mo dilisid jute harun naksimalo ni malukamagun narlo ni mana yaksar mapalyan yun ni Tana no tao nga tao si manangane hanang ituleri ng mo tuwa vernak tuleri ng mo makupi na swaro sik maku nato ay matik ima tukirangit ilamit sa kangit to kalo aman na yesulit takbyo yu atuli simay na lang ninganik December 10 minute kisa ni pipikaktit sikuta matay ma nalo na sisimagunak ng mo akik sisimagunak ng mo malitaw galinik takwa kasuyaw gaya hakata balo at sungik taw gaya hakata malitaw galit nalo na iktaw si mayuno na matwek palyan ng ano.
What defines the next steps on Nunavut's path, the decisions to maintain, lift, or reinstate public health restrictions, is the status of COVID-19 in the territory, our testing capacity, and the status of COVID-19 in southern jurisdictions. Our current plan is to complete 2 full weeks with the current measures in place. When that period is finished, we will adjust measures for most communities based on the level of COVID-19 in each community at that time. Over the past few days, our public health teams have determined that more people have recovered from COVID-19. When individuals have recovered, they are not a risk to spread the virus, and they are informed by public health that they no longer have to isolate. However, they are still required to follow the current public health measures.
Tana tukili ko tau vattu kingulla me khanu matu yapalle mga Nunavut me takwa isulit takbiuti tau yut suli isumali ko tau vamma takwa khoyana tau lutik balo atilakti tau kanner luti anna harnang itulagina mo isulit lamari tau ya hakti tau yut Tana khanu inninga Nunavut joan 19 hakkanu Nunavut me amalo khanu khawi sarunnak tiginittinnut Ambalu nuvat juar na kanu ipalya na linganun khalo nani. Mana ya pamna sumayu guta ko makupin na sa kusi malitaw kay titsi samay nang nakti guta ko nga malitaw galin isulit takbiuti taw yun. Tako isulit pata kigalak taw guta ko malitaw galit ilu nagalangin ni nunalin ni kanu tigi malilugit nuvat juar na 19 haktigi mga ata atuni Nunavut ni. Atuni nunalinne. Ullu kalau semayu ni anna hamnang itula ne mo pilari yibu nalu na semayu ta ko amisut khanui gunnek palle gutak semayu ani go jisimallo te nova joam 19 mik. Ta ko ani go jisimallo tillu khanui gunnek tillu ta ko ulu ga nak tume gunnek hatak to sa mat sigunnak na mo nova joam me. Khawi kakto hatak to Anna hamnang itulari ng mota ko ani teliga hakunne kak ningin ni. Kasi anili suli mali na kaya hamna kita ko anna hamnang itulari ng mot malitaw kaya hakutaw yun.
We have heard that people are worried about catching COVID-19 if they go to the health centers. All our health centers are working hard to minimize the risk of COVID-19. They are ensuring enhanced cleaning is taking place. Staff are wearing masks and other personal protective equipment when appropriate, and all patients are wearing masks. At this time, access to the health centers is only for necessary treatment that can't be done over the phone. If you have been asked to go to the health center, it is because the nurse or physician's assessment has indicated that you require medical attention. It is safe to go to the health center, and please don't delay necessary medical attention.
Tusaksi magates malo hatang atago kikutu ina ita ko nova juan 19 tara niak surit suti anak binno rutik ta ko atang yaktu nunalin ni anak be wat suruti hanga tawlo ka anak tumitit sitay le khulugi nova juan 19 mo ta ko lo salom maksayngin nak sutik ikana yakting ilo matwak simay nak sutik asingin luta ko timi mo sa pumiyaw gutini ato hatak sutik Anna bilang tuli malu tak ko matwak si may nakakasuting. Mana yok atuin na hako magutsi anna binita ko kisiyani inulisak tau gaya hak gutsi ukalaw tikko kamagiyaw gunang ipata. Anna bimo kuyaw guvita na pidjutilik anna siyokti lutar luni nalunar sinikat ima inulisak tau gaya kalakin nang nay. At tanang itok nunalin ni anna bilang katang namot Tako kingo variakti teilisuk nunalin ila anak bimo reakatuarutsi.
Earlier this week, I indicated additional personnel would be coming north to assist with our outbreak response. I am happy to announce that thanks to the Red Cross, we will have 4 additional resources with expertise in infection prevention and control arriving to support the team in Afiat. They will provide help with assessments, training, and protocol review that will enhance current practices. The members of this team will work while respecting our current public health restrictions. They will also follow all exempted worker protocols by wearing masks in public and workplace settings and isolating while not at work. Here in Iqaluit, the Public Health Agency of Canada has provided a liaison officer for the next 2 weeks. This will help streamline requests for support from the federal government and provide additional assistance on the ground. Thank you.
Tana pinasa ako si pigali kataktil ko nalunar sila ako makakan ni gawiak kanayak tini ukiw takti mo tikito kakan nila ako ninganik. Ikayo kaya lutisya ako mapalaya ng mo kamagi yakak tiluta. Kuwait nga nalunar sigun nakamata ko Red Cross ko tuwag ang naktulikin mo ikayok tiyo vatun. Sita maning ikanayak tining tamak kuning asyang mapalaya ni Nuqatit sigasoarne mo aulat sinar mo tikinneangata ikayoksoraartorluti piliriaartuniarveani. Ikayok siarniartu iqauyasaqattarnermik pilimatsailutik ammalu atuagarne qimeqqulutik maannoya pilirijusittinnik ikayutiqatsiarlutik. Taako ilagiyauqatauyu taako maliqatausinnaarlutik maannoyu aaneaqarnangittuliqinermu malittaugialinnik. Taako malinnearmiyut ilaat malittaukkeiniarmiyut taakununga eqqinaajartini angertaussimayuni taimangalimaaq matuarsimainaqattarlutik namungatuaraigutik ammalu eqqinaajarpinni anittailiqattarlutillu eqqinaajangitillugin. Tamaane qalunni taako aaneaqarnangittuliqinermu timiqutingi kanatami tuttarbiqartitsilertu tamaani taakkuninga maqquunni pinasuarusiuneartuni taakua tukimuartitsineartut tutsiqautigiqattarneartattinni ikajorsortaugumanittinni gavamatuqakkunut ammalu qaakkaningagut ikajorlutik parnautigi palleajattinni.
Kent Driscoll, EPTN National News. Dr. Patterson, Ontario just hit an all-time high for daily cases. Is there a point where you strengthen the restrictions relating to the south, or do you have that as locked down as you reasonably can?
Kent Driscoll, EPTN kuniluta Patterson taakua Ontario miamisuunaqpaangassamalangata taakua malittaugaali sangilerpaaliqtinniaqigitamannas pidjutigillugu.
There isn't a lot more we can do without causing harm in other fashions, in other ways. Lengthening isolation would cause undue hardship on people and cause other problems. We know that 14 days is already pretty stressful. We are taking a closer look at every exemption request, whether for critical worker or compassionate. The only other thing that we can do is when additional testing resources come online is put some of that in place to augment isolation, and that work, as we've already mentioned, is in process.
Hakanningago qaniuliula kannequnnangittugut taakkualu akkunui kanni reaqartiguttigu anittailigaaqarningi ullui 14 ungataanut atsuurnartukku kannequtaugayangat tamakkualu eqqinaajarti angertauvattuut inutuuvinniigiaqakainnangillutik ammalu suurlu ilangartuminiulutik ilangarniusanu yulnuulni angeqattaqattigu kisaani qanuiliu kanniluaqutigigunnagittavu maannauyu inutuuvinni qattariaqarningi.
It does reinforce the need for people to really consider if travel is essential before they go south, because the more people that go south, the higher the risk of introducing COVID-19 back into the territory is going to be.
Kasani taana narunaaqsigaaqutiuk kannermiyu taakko isumatsarsiutsia kannereaqaqattarningi aullareaqallarigaluarmangaami qallunaanut taima aulanginnersauqattaqqata tamanna Nunavut 19 Nunavummu tikikunnanginnersau kannerunnanga.
And knowing that no one measure is perfect, we look at all the other measures beyond just travel restrictions, things like limits on group size, on the recommendations on masks, and reinforcing the need for everybody to wash our hands, to watch our distance, and to stay home when we're sick.
Kaya magaluartugu taakua atausituammi taakua malittaugialinni atuutiqatsiaquyangimata kisaani tamakkua atangerlugi kateqsorsimalugi malittaugiali suurlu matuarsimaqattaruaqarnermut aggaminillu waasainaqattariaqarnermut inuuqatigillu qanigiilu attailiqattarnermut ammalu angeqarsimaqattarluti qanimatuaqaiguti.
Premier Savikataaq, when you were making your original comments there, talking about the $1 million spread out to all the communities, you mentioned there may be additional money coming for the affected communities. I'm wondering, what can you tell us about that additional money?
Sivlekti Savikataaq 1 million oqausiqiqqauyati nunalinnu taakko searmartauneartukiinauyi taakku nungaluattoqtausimayu nunalinnu qanukkanni oqausiqikunnaqqikikiinaujartaartu taukannernaarmangata.
Thank you. We know that all the communities are affected, so every community gets a base amount, but we also know that communities with COVID are struggling more and are affected more, and they will get more money on top of the base money. And then we're setting aside some of the money that we got from the 1.8 million dedicated for food. So if there's other affected communities, then we can help them too. Kawi magap takwa nunaliluk ta nunubu ilo na ko mata takwa nunaliluk ta nunubu ilo ni kina ta na mata mana kihene kawi magap takwa nunali nuvan na yakak to akko na kaung mata takwa kangu kina ta kanang na mata amma kina ya ilanga pihimanyak to takwa nunali ilang inuwan na yung taka latuang na pata kina ka na makakanero tuniyulo ako mga tigo matna.
Jackie McKay, CBC News. Yesterday, the Prime Minister said the federal government is giving $19.3 million to Nunavut for COVID relief. Can you tell us how that money is going to be spent?
Jackie McKay, CBC kunita nang yakadwa kanate may patso halawat 19.3 million ni gutu ni sinyang Nunavut na tulirin niya mo taako ay kisinuatok taulakan.
Thank you. 8 million of that is going to NTI, and NTI will decide how they will spend their $8 million. For us, it's going to be broken out to food and social support, which is the one I just announced this morning, and their support for delivery of critical services in affected communities, non-health PPEs and cleaning supplies, more bandwidth and IT support, early childhood, and distant learning. Takwa kino yak 19 million kaito yo government to kuni 8 million Nunavut Tungavik incorporated kuno tuni yaw na man tan 8 million ihumako tiga yaw na mat Nunavut Tungavik kuni tan likina ta lo ta but atong na ta but nakinut am Iqaluit nut nunaling nun amatan Iqaluit nut takwa piliga kadla ta to piliga unit nunaliu nuvan na yo akak to ni nunaling ni aqua kinapait matuad ubelubata aqua annoga atayo adu atoga kaktatut amma halum makhauti nunaling nun amata aqua angatitaw himayuko bandwidth aqua Iqaluit kut atok tuni amata aqua paire bing alungnut amma idin narnik angantataw himayuko.
We're over halfway through this lockdown and students in the territory are still waiting on learning resources for online. Can you tell us more on why the GN wasn't ready to implement a plan that was made months ago?
8 months.
Just months ago, over the summer.
Abba ko tilu tatamak ko mataman nginne ilinnerbe ta ko ilinerte suli ilinner ko titsangi kharisaw ya ka atuinaw ngi matasu matuinaw ngi lasuli.
Thank you. We've the Department of Education has ordered all the Chromebooks and Apple iPads and devices to connect them to the internet, but there is a worldwide shortage right now of that stuff, so they have received some stuff and have distributed some stuff, but we're still waiting on our orders, and that is, we have no control of that. And as soon as they are here, they will be distributed. I matnadakwa kakataw yako ato hokto matekwa aggamut wataw hokto tekwa Apple iPad and Chromebooks takwa tikaktaw himayut ilangit ki himalak tu aloit ki hani ilangit kinguwakta himayutako nunaryo ami luktata amigalang matamana kiheni tikit nga to pata ilinnaring nu aulayo yumaktun matnam
ulakut CBC kunningarlunga tobi utawyanga tema nunavumit iglikiksarnermit utjerngarsivalliatuinnalermat arvaani lo tikirartuarmillu kangerlinermillu saqqiyaalermat siamakpalliatillugu angiqanginni kavamakkut isumaksarsiornialerpat akuni atoqtaujunartuni illu taartukkannerassunnermit. With the pandemic going on with some communities, it is showing now that the shortage of housing is affecting the communities. The spread of the virus is mainly within households. Will the government look into long-term solution in trying to get more housing for Nunavut?
Kawi yuta ko wilo ni iglu karapta iglo atau hilo ana mi hulo atasuni tan government to kakunut o kau hirin nataratan iglo yata kanera arapta Nunavu iloni bilirari nang tabukina ya mi pikkan ni lugluta iglo yale tu lo ne arapta tan ayo naktu yu lo ki heniman nakino yakta ya man mut ikayutu na mat ki henita kwa bilirari nang tabuta ka iglo yata kan nilu kau yimai na law tatana nuwan na yo Nunavu iterne pat ta ko iglu ki kan akol na kauna matata ko ami hulo to iglo yo iloni. Thank you for the question. We've always known that we have a housing crisis in Nunavut. It's something that we admit. I've always stated that there's too many people in one house and nothing good comes out of a crowded house. I've also relayed that message to the federal government all the time, as often as I can. And we will keep dealing with it. We will keep asking for more resources to build more houses that we need within Nunavut. But the monies that we have right now is to deal with the pandemic issues right now and help the Nunavut youth right now that need the help. Thank you.
I'm a Tranter, the Canadian Press. Yesterday, you and the other premiers had a conversation with the Prime Minister. I know you talked about vaccines. I'm wondering what you can tell us about when Nunavut might get a vaccine.
I'm a Tranter, Canadian Press. Kunni patsakaw magamat. Ukakatikalaw katsanga yokardja mitamako kaputi sak nuta sakta valle alak nangini. Kanu tu salaw kinunavum.
Yes, thank you. You're correct. We did talk about vaccines on our FFM call, and Nunavut will get it as soon as the rest of the provinces in Canada gets it. Once it's approved, Nunavut will get it same time as all the other provinces. Dan kaputi ane nang ito nuvan na yamut ipaka ukaludi kut kati malawap ta Prime Minister matako hiwilyak tidukta Canada bi. Dan kaput Canada milak pat Nunavut ataw chiku piyuma magutako avik toktaw himayut piani kimalak pago ila pikpago kawiman dangit to huli ubluhunan laraw niya mga Nunavut pinya mga apta.
Thank you, Dr. Patterson, please. Can you tell us more about the Red Cross team headed to Arviat? When will they get there? What will they be doing? How is this program funded? Those kinds of things.
Red Cross go to not the quicker you have to over mula in the Hangakula Kamalukan.
Can't tell you much about the funding. They're a group of staff who are their focus is going to be on infection prevention and control and doing everything that can be done to minimize the transmission from one person to another.
Koti ko nang kita ko kino mitsano kiseni ta ko ikana yakti tikiti taw na aktu tukaga khalwar na aktu tamakko ser mapallani ngani no khartit siga swar na mo awlat sinagmullo.
And when are they arriving?
Hangako tikilangata.
I think they either today or tomorrow, if I remember correctly. Yeah.
Are you sure? Ulumi kaupalluni.
Megan Dooling, Nunatsiaq News. My questions for the Premier, please. So I understand that the $8 million that NTI and Quebec Inuit Association got, they have to sign contribution agreements and they don't know when they're going to get it. Do you have any idea when you get the $11.36 million?
Megan Dooling Nunatsiaq Sivulaktimutana. Tako 8 million Nunavutunga Vikunut Amalu Kivalak in Wikatjakati in North Town Artut. Kina yakta tito ng mga kati utiku na ngata hanga kopia wala kat Amaluta Kwarka Hanotok Tawlak $11.36 million.
Thank you. We'll be getting it very shortly. We've been assured that we're getting it right away. I can't say whether it's today or next week, but we're getting it right away. And as soon as we get it, it'll be the food portion will be given to the hamlet. We have contribution agreements ready for the hamlets. Ta'ana kina ta'ana ta'wot kaitaut na ublumi upakawulun ni hauli tiana umai. Kihani tuawang natuko kaiti taon na ta'ana kina ya ta'ana government kun toang na to amma pit na to op tigo ta'ana nakimut watcha unikare ta hamlet kunita kuninata.
And just like based on the press release, there's all kinds of different allocations to different organizations, and I know you have the contribution agreement ready with the hamlets, but what's your plan for efficient distribution of the rest of the funds? Who are you working with to make sure it's spent as efficiently as possible?
Tako apiwala yola kanang natusakat siya na lunar sa kaumata jiging ito no tako ito kala ng atakina kina ya hatit sinagmulo ang katigi ko hamlak ko tako aligamik ame akong kisamatok tao nakat.
It's my understanding that the government will be spending that money in those, what I talked about, support for delivery of critical services in affected communities, non-health PPEs, cleaning supplies, and the bandwidth. The government will be doing the actual purchasing, is my understanding. Ta'ana kina ya kaitaw niya government to kakuni. Take na nekamutora na hamna kuno tuniona kihani takwa government kuta na kino ya tong na ta new world takwa watcha unikare lauta ni takwa pileri kanyang nut ama piara kaktu ni takwa nunali nuban na yo kaktu ama takwa matoa kina pai takwa atayud ama halam makhauti nunaling nun ama ta ikyako min atong na na takwa government kino atong na tanga matna.
Thank you.
Trevor Wright, Nunavut News. My question is probably for Dr. Patterson. I realize it's next week, but at this point in time, which communities are going to be remaining under lockdown when it's over, when the 2 weeks is over?
Tana Trevor Wright Nunavut News kun ni pinasa ko siulak tamita ko kasuya wala gum na lakata taman na matuyaw si maninga nalya ni nunalin ni laka.
The measures will be the most protective, most stringent for any community that has evidence or concern of community transmission. For communities that have transmission only within households or known links, there will be some increased measures, but they won't be as strict. And then there will be the rest of the communities, which will, as I mentioned earlier, probably be closer to where we were in June or July. Businesses will be open, but gathering sizes will be limited.
Takuana hamangin tulakina mamalit tau gali tamakwa sapodji gutau simayo nunalin Nunavut 19 talin ni takununga nunalin ni ser makbeu simang ito akata ilumio hatigi ni ser makbeu simayo ni kisani tako ilang nunali taima China June mi July miluni malit tau gali akala tuni lauk tuni taima China lauk tu kisani isulitak beharlute khatsi katekhatakun ng mangata.
So right now, the communities that will be most affected by measures will be Rankin, Whale Cove, and Aviat.
Taka mana yo atok tau nakpangulak tu taku nung malit tau gali no pilo ang nakpangulak tu kanyang sinang me tikirak joami akveanilo.
How goes the monitoring in Savikataaq? The 2 cases have since recovered. Everything going well, or?
Tako ala kanoy kun niyang nakasimayawlak tilugi tako sa nikilo ang mikaw yasak tau ning kanoy lakkan.
Yeah, there's a few people who remain in isolation, but everybody is doing well.
Tako amisulu ako niya tu ala anit tayo titaw yung kisa na ilaw na ti kanoy ngitun.
Okay, Dr. Patterson, just to follow up there, I'm wondering specifically, Kent Driscoll, EPTN National News, I'm wondering specifically about schools reopening starting next week. I'm wondering on their plan, do you know what phase they'll be coming in at? Will they still have split shifts for some of the schools? Can you sort of take us through what that's going to look like?
Kent Driscoll EPTN ko niluta Patterson ta na pigigakan na tu pinaso ako siulak tu mailin na bit. Matuyak panlea mga ata tamakwa hutin niliri matuyak panlea ning Nunavut nalea nilakan.
I'm meeting with the Department of Education later today to discuss that, and I believe by Monday we'll be ready to make the announcement on the exact plan. But yeah, schools will be in a different position when reopening happens, just based on their plan, based on what we know of the increased risk of COVID-19 coming into the territory in all communities.
Tako no sakati mahatigi na taka ilin na tuliridik ilin na nilirikut. Nagkadjami kaya nalo na sila aktigo kanula tapang na takasuma mga ta. Tako ilin na beadjong ito may kano matuikan nakpalaya na mga ta ukaw sirilak tapo nunalilimano.
Jackie McKay, CBC News. Given the specialized team going to Arviat from the Red Cross, is that because community transmission is still remaining a problem there?
Jackie McKay, CBC kunita ko kaya mayite akveanong nang Red Cross kunito ang naktuliri kunita may mano na linisa ang mapalaya ng anong pidjutikaka.
There hasn't been any cases where we can definitely say that it has occurred for a few days, but at the same time, it takes a little while to know for sure. And so we're operating under the assumption that it is right now. And as we've always said, when in doubt, it's better to be over-aggressive with this so we get it under control quicker. And so when the opportunity to take advantage of this offer of assistance came up, we weren't going to say no.
Weren't going to say no?
Weren't going to. Sorry, poor choice of words.
Tako ila siang mapalya ning ano pidjutigillugo tako nalo na siya simal gumalaw ka teka yok taw chauti gumalo tatu inautit sila ng teka yok maningin ni tayo mai ka yok taw gumat siya tugu tayo man na ay
Kuya namin tagbunga sana nangin na mo tikipalya lang mitidluta bato si matidlugidluta magkuha sunalugtano na wiluan ni kuya namin ako mo lugino na bumiyot ipaksan ni apirilaw ako matana matuyaw yak tidlugo Nunavut ikayok tigi yung mablusi taman na siya magtayla ni kaya nga pidyo tigi blugo taman na malit siya kaya kakap tigo nila Kanigiluak tailinak, nalaglutiguluitluak sayar joarayavut, takwa inutu iaqattarluta, mianarilutigul qitungavut, silalirput, amma piluartumi innatuqarput. Takusimaleraptaqanu, taamna nuwagjuarnaq nunalingmi, aktuiyunnarmangaan, uloreanarnerianganiglu. Qilamialuk, sunaluk taasitjerunnartut nunavummi. Taamna pilereariaqaraptigut, katsungilluta, nuqqarnit nasungneq siamak palliania taapsuma aanniarniu. As we head into another weekend of our lockdown, I would like to say thank you to Nunavut. I asked you 2 weeks ago when we announced the lockdown that the only way we will beat this virus is we must be vigilant in our social distancing. We must listen to the CPHO orders on isolation, and we must protect our families, our neighbors, and most importantly, our elders. We have all seen how quickly this virus spreads and impacts the community. We have seen how quickly things can change, and we need to remain focused in our fight to slow and limit the spread. Anikataktailinulu kisiani iqqaitinna sutuinnarpapsi uglaqaqattangilluta iglumioqatigiptinni najoqsiittuinnarluta tamanna atoreaqallattaaqaluaraptigu qaglittaililuta aggavermiinnarlutigut ikusiptinnoqertorpagluta amma tamakkuaqtortaariuktu iglu iluani tigummiviit ipuit matuit allaqayuglugit amma anis iglu iluani kaluarlutalunni ayungittaraangapta qanamut matuarni neorekkutini atoqasuqattarta. It's hard to not socialize, especially when you're very social in the small communities. I just remind you to please work at it. Don't socialize outside your household. This is just so very important. Please be strict with maintaining physical distance, washing your hands, coughing into your elbows, cleaning surfaces regularly, and wearing a mask outside your home. I know you're probably getting tired of hearing this, and we're getting tired of saying it probably, but it's very important to listen to the rules. We also need to recognize our healthcare providers, not only those on the ground in the communities, but those that are working remotely by phone. They are putting in many hours to ensure you are well. So please be kind in your discussions with them and thank them when you can. Ilitariyareaqarmigaptigutamakku sanayartoriaqaqattartut matusimagaluartilluta piluartumi aanniarvingmi pileriyut aanniartaalimayulerinermi pileriyut inuleriyillu ammalutaikkua uqaluutiinnakkut uqaqatigiyaavaktut taqavangmingmata ikaqanu amisuaungu pileriqattarmata uqaqatigiyaraangaptigut tukisiumanasuqattarta tunganarlutalu tagwanisanannauniangitillugu qasungatjuumiyunnartugugalua kisiani qaglidjutittaaliniarpugut inuqatigiitsiaqapta saalagiyunnartavut nunaqqatigiitigut nunavummiutigut ajungittuagapta taanna anigortittunnartavut anigortinniartavutlu ikajortigillu tikisiani. Again, in closing, I just want to thank all of Nunavut for their hard work. We can beat this, and we will do this together. Thank you.